Hi everyone, it's Ajanette and I am back to cover part 2 of your chapter 2 neuroscience lecture. When we left off, the video actually cut me off right in the middle of talking about action potential, but I guess that's what I get for not paying attention to the clock, because I kept rambling on long after the video had stopped. So anyway, that being said, I think we were talking about the membranes that are the ionic channels along the membrane of the neuron, and how they open and close in kind of a sequential pattern across the membrane of the neuron. And what that does is the positive charge is flowing in, the positive ions are flowing in. It's changing the charge from negative to positive within the body of the neuron. But it's doing it in a wave-like motion along the membranes as they open and close, open and close, open and close. So it moves this positive charge gradually down the axon of the neuron. So when this is happening and those ionic channels are opening and the positive sodium ions flow in, that's actually what we call depolarization. So potassium flows out, sodium flows in, and consequently it's polarizing or depolarizing. In other words, they're no longer on opposite poles. It's depolarizing. They're now flowing and moving and exchanging, and it's creating that positive charge along the axon of the neuron, and that's what we call action potential. And so another issue that becomes relevant, I'm just going to move me over here, is what happens once that positive charge reaches the end of the axon. Then the charge comes out, and along these terminal buttons, there is a release of the vesicles, and inside the vesicles are the tiny little neurotransmitters that are released into the synaptic gap. And then what happens is the dendrite of the neighboring neuron, so this is the receiving neuron here, the dendrite has receptor sites along the dendritic branch, and those receptor sites are specially designed to pick up that neurotransmitter and essentially translate or transcribe that chemical message into something our brain can now understand. And so beyond our neurotransmitters, sometimes we're exposed to drugs. So neurotransmitters are going to excite and activate another action potential, or they're going to inhibit and keep another action potential from firing. And beyond neurotransmitters, sometimes we can ingest psychoactive drugs or other type of drugs that might actually serve as agonist or antagonist. So an agonist is going to bind into the receptor site and mimic the excitatory message of a neurotransmitter. So it's essentially going to activate the neuron the same way that the neurotransmitter would. An antagonist drug, think about someone that's antagonistic. They're fighting you, they're blocking you from your goals. So an antagonist is a drug that binds to the receptor site, and instead of acting on behalf of the neurotransmitter or sending that same message, it blocks the neurotransmitter from doing the job. And so it essentially inhibits or interferes with that neurotransmitter. So our neurotransmitters, as I mentioned, they're chemical messengers, and these are the main ones outlined in your book that you should be familiar with. So keep this chart handy. Serotonin is largely related to our mood. It does play an interactive role in the impact of depression. It is in fact related to our ability to sleep, and then overall it influences some things like our temperature regulation, pain, impulsiveness, things of that nature. But when serotonin levels are too low, those often, that in combination with some of the other neurotransmitters, particularly norepinephrine, can actually influence our depressive tendencies. Acetylcholine is often related to muscle action and REM. They also think that it might be involved in Alzheimer's. Dopamine is related to our movement and can influence and affect our attention as well, our memory, and kind of our language processing, particularly in terms of learning. And dopamine actually is involved in 2 major disorders. Schizophrenia is when your dopamine levels are too high, and then Parkinson's is also when your dopamine levels are too low. And then obviously, you guys may have heard of like addiction, that dopamine reward center. So addiction can also increase, drugs can also increase your dopamine. Norepinephrine, we talk about adrenaline and noradrenaline. So the official terms are epinephrine and norepinephrine. So norepinephrine actually helps to counterbalance epinephrine in terms of our autonomic nervous system, but norepinephrine can also influence our sleep behaviors, our dreaming, learning, memory, and our alertness as well. And as I mentioned, it interacts with serotonin to influence our depressive episodes, or those individuals with depression. What we find is when serotonin is low and norepinephrine is low, individuals are likely to experience depression. But when serotonin is low and norepinephrine is high, they actually might experience mania. And that's what we call an interaction where the effect of low serotonin depends on the level of norepinephrine. Epinephrine is related to that kind of energy, that fuel. I like to think of it as our body's natural rocket fuel. And it gives you that burst, that energy burst in the fight or flight and stress response. GABA is one of the few inhibitory neurotransmitters that kind of slow us down and settle our neurotransmitters down. And when we don't have enough GABA, we're not getting enough slow down messages, and so our neurons can be a little bit high strung, and low levels of GABA are often associated with anxiety. So, and then endorphins are, you've maybe heard about the runner's high. When you're exercising, you get kind of this euphoric mood, and that also allows you to kind of push through the pain as well. Okay, so those are just kind of the basic neurotransmitters you should be familiar with. So moving away from the nervous system, looking at the endocrine system. So basically our body has 2 main systems involved in kind of controlling the communication and regulating the body systems. The endocrine system does it through glands and the release of hormones through our blood system. So it's a much more global method of communication, where our nervous system does it by sending one message from the brain to another neuron, or from one neuron to another, or from a nerve to the brain. And the endocrine system is a little bit more global, as I mentioned. Each of the glands that are part of the endocrine system release hormones into the blood system, into the bloodstream. And so everybody kind of knows what's happening and what messages are being relayed by the endocrine system based on those hormone levels. The most important glands that you need to be familiar with are probably the hypothalamus, which is actually part of both the nervous system and the endocrine system. It really is kind of the conductor, the general of sorts, and it activates either the nervous system when necessary or the endocrine system when necessary, depending upon what it considers to be out of balance. So the hypothalamus really kind of is a major part of regulating homeostasis, or that biological balance within our bodies. And then if it needs to, it will activate the pituitary gland, and the pituitary gland is considered the master gland of the endocrine system. So it's like, you have your president, and then you have your Congress, and the head of Congress is who, or the head of, the Senate is who. So the pituitary gland is like the Speaker of the House, so to speak. So the president activates the speaker, and then the speaker activates the House of Representatives. Let me see, what else? The pineal gland is a really important part of our sleep cycle. So it actually detects the different light availability, and based upon that, it's going to produce melatonin to let us, our bodies, know that it's time to sleep when it's dark outside. The pituitary gland, once puberty is triggered, it will activate the adrenal gland, which then will activate the gonads, which are going to be our ovaries and our testes, and that's going to influence the development of, sex hormones and primary and secondary sexual characteristics. So those are kind of the main general functions of our endocrine system. Our nervous system, here's a nice breakdown of the nervous system. Your nervous system breaks down into a different categorization. So first of all, our overall nervous system is the entire structures. The central nervous system only contains your brain and your spinal cord, and then the brain further breaks down into a number of different ways, and we'll talk about a number of them throughout the rest of the slides. But we first break it down kind of in segments, and you have the forebrain, the midbrain, and the hindbrain. From an evolutionary standpoint, the hindbrain and the midbrain were thought to have evolved first. They often are associated with kind of regulating just keeping us alive, our heart rate, our sleep cycle. Our reticular formation is involved in our alertness and our arousal, and the cerebellum is largely in control of coordinated movements of your body, and it does have some higher functions as well. And then the latter part of the brain to develop was considered the forebrain, and this is what's involving our cerebral cortex, which is, that higher functioning. What we usually think of when we think of a brain is that wrinkly outer surface of the brain. Then there's the thalamus, which is the switching station for our sensory experiences, our limbic system, which regulates our emotion, and then the hypothalamus, which is kind of the conductor of all things and just making sure that all systems are working appropriately together. Then the peripheral nervous system, if you think of periphery, it's the stuff on the outside, and that actually is controlling our somatic nervous system, soma again meaning body, so our nervous system that governs the senses of temperature, touch, things of that pain, things of that nature that we feel in our extremities, takes those messages to the brain, or the brain gives the messages to move our hand in a particular way. So it's really controlling our muscles, our voluntary movement to either, move something, respond to the pain, and not in a reflexive way because that's managed by the spinal cord, but in a way that we might tend ourselves, or we might move an object out of harm's way or something of that nature. And then the autonomic nervous system, if you think of automatic, this is our fight or flight response. So it's controlled by the sympathetic and the parasympathetic. I like to think of this as the on and off switch, or the gas pedal and the brake pedal, where if you're, challenged by a saber-toothed tiger and someone jumps out in front of you and you're in a life or death situation, your body's going to activate and it's going to shoot rocket fuel, which is epinephrine, throughout your body so that you can either stand and fight and conquer, or you can run and get the hell out of there, which is what I would do. And so after you get out of there, your body can't keep going full charge. It can't continue to have that rocket fuel, or it's going to explode. So now your body needs to activate the off switch, and it needs to hit the brakes and say, calm down a little bit, bring yourself back into neutral or homeostasis, and that's facilitated through our parasympathetic nervous system, which then activates the production of norepinephrine to kind of slow us down and bring us back into balance. So that's the nervous system. I'm going to stop there and then come back and discuss part 3. I'll be back in just a moment.